Good evening, all. Okay, so today we will have some question discussion. First one, expired C2 drugs. Okay, so what do you mean by expired C2 drugs? What is the correct statement regarding expired C2 drugs? Option A, they should be returned to the distributor for credit. Option B, they must be destroyed in accordance with applicable state or federal regulations, and the destruction must be documented to the satisfaction of the DEA. Option C, must be returned to the manufacturer in accordance with the DEA regulations. Option D, are destroyed in accordance with good manufacturing policies.
Option B, ma'am.
Yes, option B is the right answer. Expired C2 drug means they are expired controlled 2 drugs, controlled schedule 2 drugs. Okay, these drugs have high abusive potential. Okay, so they must be destroyed according to strict regulations of state and federal regulations to prevent their misuse and environmental harm. And DEA, Drug Enforcement Administration, requires these expired drugs should be destroyed in a secure and irreversible manner. Okay, we can employ the techniques like incineration and chemical neutralization so that it cannot be diverted back into initial form to elicit their use. Okay, otherwise there are chances for further misuse. So it should be properly destructed. According to strict regulations of the state and federal regulations, they should be properly destructed. The methods like incineration or chemical neutralization can be employed. And after destruction, it should be properly documented also. Okay, the details like drugs name, quantity destructed, then method of destruction, date of destruction should be properly documented. So expired C2 drugs means they are controlled medications. They can cause high abusive potential. So we like normal drugs we are using, the drugs we are using commonly, we cannot just return back into the manufacturer. Okay, it should be properly destructed. Next question, which type of pharmaceuticals are found increasing amount in waterways and drinking water? Okay, which pharmaceutical is found to be increasing amount in our waterways and drinking water? Option A, injectables. Option B, contrast media. Option C, antimicrobials. Option D, over the counter products.
Option C, ma'am.
Yes, option C is the right answer. Antimicrobials like antibiotics are found to be commonly increasing amount in our waterways and drinking water. Commonly, it enters into water system through human and animal waste. Okay, we are improperly disposing human and animal waste and from agricultural runoff. And in case if we are throwing the antibiotics, the remaining antibiotics after our use into our waterways and all, that causes increased amount of antibiotics in our water system, waterways and drinking water. And it is currently a common problem we are facing. Okay, it is a common issue currently we are facing. It causes a significant public health risk. Okay, when we are drinking this water, when we are using the water from these waterways, unknowingly the antimicrobials enters into our system, our body. Unknowingly we are drinking the antibiotics, so that causes antibiotic resistance. Okay, and leads to development of the antibiotic resistant bacteria. It is a common problem, public issue that we are facing currently. Okay, so antimicrobials are found to be increasing amount in our waterways and drinking water. Next question, the first set of numbers in an NDC number signifies. Okay, in NDC number, first set of number signify what? Option A, package size. Option B, specific product. Option C, manufacturer. Option D, schedule of the controlled substance. Which one?
Option C, ma'am. Manufacturer.
Yes, option C is the right answer. So NDC number means National Drug Code Number. Okay, National Drug Code Number. It is assigned by FDA. It is assigned by Food and Drug Administration, and it will be typically structured in a manner 542 format. Okay, like this format it will be structured. The first digit, first number segment represents manufacturer. that helps to identify the manufacturer of the drug. Okay, which company manufacturing or which company distributing this drug we can identify by using first segment. And second segment identifies the specific product. Okay, that is drug formulation, strength, or dosage form, like that it implies. And the third segment indicates package size. Okay, so first segment represents what? First segment.
Manufacturer.
Second segment.
Drug formulations.
Yes, specific product. What is the specific product? Like drug formulation, strength, and dosage form. And the third segment represents?
Package size.
Yes, package size. So NDC number, National Drug Code number, is a unique identifier. We can identify the drug. Next one, which auxiliary label should be affixed to a prescription vial containing metronidazole? Okay, so we have a vial of metronidazole. Which auxiliary label should be fixed? Option A, do not drink alcohol. Option B, take with food. Option C, do not take within 4 hours of dairy products. Option D, caution, may be habit forming.
Option A, ma'am. Disulfiram glycopate can occur.
Yes, right answer. Option A, do not drink alcohol, because when we are taking metronidazole along with the alcohol, there occurs a serious drug interaction, that is disulfiram-like reaction, that can cause severe symptoms like severe nausea, vomiting, flushing, and rapid heart rate, tachycardia. So we should not take alcohol along with metronidazole. At least we should wait for 48 hours. After taking metronidazole therapy, for at least 48 hours, we should not take alcohol. So the auxiliary label is do not drink alcohol. Next question. The pharmacy received a notice for class 2 recall for fentanyl patches. What is the first step the pharmacy technician should take? Okay, in a we are working in a pharmacy, and we are getting a notice for class 2 recall for fentanyl patches. What is the first step we should take? Option A, isolate all the recalled lot numbers. Option B, file the notice. Option C, prepare a list of patients to contact. Option D, return all the fentanyl in stock to the manufacturer.
Option A.
Yes, option A is the right answer. Okay, in case of recall, class 2 recall means that product may cause temporary or medically reversible adverse health consequences. Okay, here we are getting recall for fentanyl patches. When again, if we are using fentanyl, that batch of fentanyl patches that can cause severe adverse health consequences. Okay, so initially, what should we do? We should isolate all the recalled lot numbers. According to the lot number, that fentanyl patches should be isolated or should be separated from the stock. Okay, otherwise there are chances of accidental dispensing. We may accidentally dispense it further to any patient. That can cause severe adverse events. Okay, so the first step we should do is isolate or separate all the recalled lot numbers. Then we can proceed further steps, like sometimes we may already dispensed some batches of fentanyl batches recalled. Okay, so in that case, we should call the patient and ask them to return or make arrangements to return them. And we can proceed further disposal of the recalled items. Initially, we should isolate or separate all the recalled lot numbers, fentanyl patches. Understand? Next question. A category of drug on ISMP high alert medication list is. So, which drug category belongs to ISMP high alert medication list? Option A, antithrombotic. Option B, corticosteroid. Option C, ARBs. Option D, antihistamines.
Option A, ma'am.
Yes, option A, antithrombotics is the right answer. So, ISMP means Institute for Safe Medication Practice. Okay, they have a medication list, that is high alert medication list. High alert medication means if we are not using properly, okay, if we are used those drugs improperly, or in case of medication dosing error, that can cause severe adverse drug reaction, severe risk. Okay, so antithrombotics belongs to high alert medications. Antithrombotic medications, what is the indication of antithrombotic medication? They will prevent blood clotting, okay, like anticoagulants and antiplatelets. These are the antithrombotic agents. If we are using these medications improperly or in case of dosing errors, that can cause a severe bleeding, okay, hemorrhage or severe thrombotic events can happen. Okay, so antithrombotics belongs to high alert medication list. So high alert medication means if you are using improperly or in case of dosing error, medication error, any kind of medication error, that can cause severe problems in patients. Next question, Abilify is an. So Abilify is the brand name and it belongs to which category of drug? Option A, anti-diabetic. Option B, antidepressant. Option C, antibiotic. Option D, antipsychotic. So Abilify is aripiprazole and it belongs to aripiprazole.
Answer D, ma'am. Then answer D.
Yes, aripiprazole belongs to antipsychotic agent. Okay, we are giving in psychosis conditions like schizophrenia, bipolar disorder, and as an adjuvant in depressive disorder. Okay, it can balance the neurotransmitter level in our brain and improve the symptoms like mood swings, hallucination, and disordered thinking. So, Abilify means aripiprazole. Okay, aripiprazole, we know that it belongs to antipsychotic medication. The term weight in volume, W by V, refers to the number of. Okay, so W by V means what? Option A, milligrams of the drug per 100 ml of final solution. Option B, milligrams of drug per liter of the final solution. Option C, grams per 100 ml of the final solution. Option D, grams per liter of the final solution.
Option C, ma'am.
Yes, option C is the right answer. Grams per 100 ml of the final solution. So just I will say an example. 0.9 percentage weight by volume means 0.9 gram in 100 ml of the solution. Understand?
Yes, ma'am.
0.9 percentage weight by volume means 0.9 gram is present. 0.9 gram NaCl is present in 100 ml. Okay, this is very important regarding your calculation part. Okay. Next question, which question should be referred to a pharmacist? Okay, when we are working as a pharmacy technician, we will get so many questions. So, which question should be referred to a pharmacist? Option A, who manufactures Lovanox? Option B, how much codeine is in one Tylenol 3 tablet? Option C, what is the difference in price between brand name Valium 10 mg tablet and generic version? Option D, if I am allergic to penicillin, is it safe for me to take erythromycin? Which is
Option
the
D,
answer?
ma'am.
Yes, option D is the answer because option D is more clinically significant question. Okay, it should be referred to a more expert person. We should refer to a pharmacist. Like potential drug allergies. Okay, in case of questions involving potential drug allergies, then interactions, then adverse drug reaction and all, these questions should be referred to a pharmacist. Understand?
Yes, ma'am.
To ensure patient safety, we should refer to a pharmacist. More clinically significant question should be transferred to a pharmacist. Next question, stock rotation is a process of. So what do you mean by stock rotation? Option A, placing newly received product behind all other products on the shelf. Option B, returning outdated products. Option C, filling the ADC with products as they are received. Option D, inventory recycling.
Option A, ma'am. FIFO.
Option
Yes,
D, ma'am.
option A is the right answer.
First in, first out.
Yes, first in, first out, FIFO. Okay. So placing new products in the backside so that we can ensure that the older stock is used first. Okay, that we can ensure that the products already in the stock that are used or say sold before the expiry, we can ensure that. Okay, so first in, first out, placing the newly received product behind all the products on the shelf. That is known as stock rotation. Next question, a fill list is used by a technician. A pharmacy technician uses a fill list. What do you mean by fill list? Option A, to process orders to the wholesaler. Option B, to process the daily cart fill. Option C, to compound sterile products. Option D, to refill crash carts or trays.
Maybe option D.
Yes, option B is the right answer. Okay, to process the daily cart fill. Okay, fill list means it is a list of medication. Okay, in a community setting, healthcare setting, or a hospital settings, there will be patient-specific medication card. Okay, for each patient, there will be a specific medication card. So we should fill that card daily. Okay, in order to supply the medications treatment for the patient on time or correct time, we should fill that patient specific medication card. Okay, so what are the medications required to fill or restock that medication list? It is known as fill list. Okay, in order to fill that patient specific medication card, which medications are needed? Okay, which medications are needed to refill or restock that medication card? That list of medication is known as fill list. Okay, fill list is used by a pharmacy technician to process daily cart fill. Understand? When should a patient profile be updated on a community pharmacy? When we should update patient profile? Option A, annually on patient's birthday. Option B, EHR eliminates the need to update the profile. Option C, every time the patient gets a prescription filled. Option D, only when pharmacy updates their software.
Option C.
Yes, option C is the right answer. We should update patient profile every time the patient gets a prescription filled. Okay, every time the patient fill a prescription, we should update the patient profile. Only by that we will get the update, up to date information of the patient. Okay, what are the current medications and what are the allergies of the patient? Then any other relevant health information like that we can update in each refill of the prescription. Okay, we need the current information of the patient, not the older or previous information. We need the up-to-date current informations of the patient so that we can provide safe and effective patient care. So every time the patient gets a prescription filled, we should update patient profile. Next question, what category regulates registration and licensure of the pharmacy technicians? Option A, State Board of Pharmacy. Option B, National Board of Pharmacy. Option C, American Association of Pharmacy Technicians. Option D, Pharmacy Technician Certification Board.
Option A.
Yes, option A, State Boards of Pharmacy. In every state, there will be a State Boards of Pharmacy, which will create responsible for setting regulations for pharmacy technicians. Then licensing procedure, registration requirements, all are handled by State Boards of Pharmacy. The book which is used uh, used to look up approved drugs and bioequivalent generics. The book we are using for approved drugs and bioequivalent generics. Option A, blue book. Option B, red book. Option C, orange book. Option D, PDR.
Option C.
Yes, option C, orange book is the answer. Orange book contain all the approved drugs and bioequivalent generics. Okay, so it is very helpful for healthcare professionals, including pharmacy technicians, pharmacists, and doctors and all. It is very helpful. It contains approved drugs and their bioequivalent generics. Okay, so in case we can for alternative medications. Okay, producing same effect to find alternative medications, bioequivalent generics, we can refer orange book. And PDR means physician desk reference. PDR means physician desk reference. There will be a small book on doctor's table that is known as physician desk reference, that is used by the physicians for their reference. Okay, red book mainly contain availability of the medications and their price. Blue book also contains some prices of medications. Okay, so here orange book is the answer that contain approved drugs and their bioequivalent generics. Next question, your pharmacy has a computer system that maintains a perpetual inventory with minimum and maximum stock levels for all the inventory. Once an order is received, what is the next step the technician should take to maintain integrity of the future orders? Okay, so we are working in a pharmacy that has a computer system that maintains perpetual inventory system. That is that will show, the system will show minimum and maximum stock level for all the inventory. Okay, so once we are receiving an order, what is the next step the technician should take? Option A, rotate stock. Option B, update all prices. Option C, enter the quantity received. Option D, enter the quantity of the back order drugs.
Option C, ma'am.
Yes, option C, enter the quantity received. Our system maintains all the perpetual inventory system that will show minimum and maximum stock. We need to enter the quantity received. Okay, so that will show us the minimum and maximum stock so that we can maintain the integrity of the future orders. Just we want to enter the quantity received. Okay, after once the order received, we should enter the quantity received. Next question, which of the following step in processing a prescription in a community pharmacy is a pharmacy technician allowed to do? So, which task is allowed to do by a pharmacy technician? Option A, override warning. Option B, create the label and affix it to the filled container. Option C, perform the final check. Option D, counsel the patient.
Option B, ma'am.
Yes, option B is the right answer. We can create the label and affix it to the filled container. Okay, other tasks are some more clinically significant. It should be handled by a pharmacist. Okay, counseling and all. Then warning. Then to perform the final check, these are the responsibilities of a pharmacist. We can label and affix it to the filled container. Okay. Next, a barcode on pharmaceutical product is encrypted with. Okay, for each pharmaceutical product, there will be a barcode that is encrypted with option A, the chemical name of the drug. Option B, the brand name of the drug. Option C, MSD information. Option D, NDC number.
Option D.
Yes, barcode is encrypted with NDC number. We already studied that national drug code number. Okay, NDC number means national drug code number. And the first set of number of NDC number represents what?
Manufacturing, ma'am.
Yes, manufacturers. Okay. Next question, an e-prescription decreases potential for. Okay, what is the advantage of e-prescription? Option A, rejection. Option B, lawsuits. Option C, forgeries. Option D, non-compliance.
Option C.
Yes, option C, forgeries is the answer. E-prescription means the prescription is directly transmitting from the physician into the pharmacy. Okay, so that we can avoid forgeries. Then that helps to enhance security and accuracy. That is known as e-prescription. So the major advantage is we can reduce the risk of forgeries. Next question, base components of a TPN include. TPN means what?
This is infusion solution. Name I forgot, ma'am.
Total parental nutrition.
Yes, total parenteral nutrition. Okay, so what is the basic component? Option A, multivitamins and dextrose. Option B, electrolytes, dextrose and amino acids. Option C, dextrose, lipids and electrolytes. Option D, dextrose, amino acids, water and sometimes fat.
Option D.
Yes, option D is the right answer. Dextrose. It contains dextrose, amino acids, water, sometimes fat also. These components can provide essential nutrients for the patients. We are giving TPN actually for bedridden patients and all. They cannot achieve the required amount of nutrition through regular oral intake. In that case, we are giving total parenteral nutrition. So these components can provide essential nutrients for the patient: dextrose, amino acids, water, sometimes fat. Next question, which of the following statements is true concerning the task that can be performed by pharmacy technician? So which task can be performed by a pharmacy technician? Option A, pharmacy technicians can perform all pharmacy tasks when supervised by a pharmacist. Option B, pharmacy technicians can perform tasks as permitted by federal and state pharmacy laws and regulations. Option C, pharmacy technicians can perform any task without supervision of a pharmacist. Option D, pharmacy technicians can perform any task requested by a pharmacist.
Option B.
Yes, option B is the right answer. Pharmacy technicians can perform tasks permitted by federal and state pharmacy laws and regulation. Okay, within that regulations, state and pharmacy laws and regulations, we should work, or a pharmacy technician should perform the task. Okay, within that legal boundaries, we should work. Usually there will be a pharmacist, and under that supervision of pharmacist we are doing our task. Next question, which of the following is not normally required to become a registered or licensed pharmacy technician? To become a registered or licensed pharmacy technician, which is not required. Okay, not required. Option A, degree from a school of pharmacy. Option B, a minimum age. Option C, completion of a training program including pharmacy employer training programs. Option D, high school diploma or equivalent.
A, ma'am.
Option.
Yes, option A is answer. We does not need a degree from a school of pharmacy. We need diploma. Okay, to work as a or to registered or licensed, to become a registered or licensed pharmacy technician, we need a diploma only. Which question can a pharmacy technician answer? Option A, when will the shortage of methylprednisolone be over? Option B, how much acetaminophen should I give my 2-month-old infant? Option C, can I store this antibiotic suspension in the freezer? Option D, does simvastatin interact with grapefruit juice? What should I substitute for morphine if my patient is allergic? Which question can be answered by a pharmacy technician?
A, ma'am.
No.
Option C.
Yes,
Option
option
C.
C is the right answer. Okay, can I store this antibiotic suspension in the freezer? Because this pharmacy technician will get training on storage and handling of the dosage forms, handling of the pharmaceutical products. So we can answer the questions related to storage and handling of the pharmaceutical product we can answer. Okay, so option C is the answer. Can I store this antibiotic suspension in the freezer? This question can be answered by a pharmacy technician. Okay, then the questions that is more clinically significant or involving drug interaction, drug allergies, or adverse drug reactions, that clinically significant questions should be transferred to a pharmacist. Understand? Okay, we are discussing this kind of questions. 2 or 3 questions we already discussed. We should select an option that is less clinically significant. Okay, more clinically significant questions should be transferred, should be referred to a pharmacist. Okay, the question regarding storage, then handling of the pharmaceutical product can be answered by a pharmacy technician. Next question, a new patient brings a prescription to the pharmacy. What information should the technician obtain from the patient? Option A, the patient's date of birth, any allergies to medications. Option C, prescription insurance information. Option D, all of the above should be obtained.
Option D, ma'am.
Yes, all of the above is the right answer, because a new patient is coming to our pharmacy. So we should collect all the information of the patient, like patient's date of birth, any allergies to the medication, then insurance he have. All the information we should collect in case of a new patient. In addition to the prescription filling process, a technician may be responsible for all the following except, okay? So here except, which cannot be done by a pharmacy technician. That is the question. Option A, managing inventory. Option B, managing pharmacy records. Option C, providing disease state management service. Option D, preparing compounded drugs.
Option C.
Yes, option C. It cannot be done by a pharmacy technician. Providing disease state management service is the comes under the practice for pharmacist. So it requires more expert, clinically more expert person. So we are referring to a pharmacist. That involves direct patient counseling and all. Okay, state management services, disease state management services involves patient counseling and all. It should be referred to a pharmacist. Pharmacy technician cannot do. Okay. Next question. Which of the following statement about prescription labeling is false? Okay, which statement is false regarding a prescription labeling? Option A, some prescriptions require labeling beyond what will fit on the label itself. Option B, auxiliary labels are often used to clarify or elaborate on directions for use. Option C, if the patient is in a hurry, it is acceptable to dispense the prescription without an affixed label, as long as you talk to the patient about how to use the medication and he or she understands. Option D, most states have specific requirements about what information must be included in prescription labeling. Which one is false statement regarding a prescription labeling?
Option C.
Yes, option C is the right answer. Okay, option C says that if the patient is in hurry, we can dispense it without label. That is a wrong statement. It is not acceptable in any case, regardless of the patient situation. It is not acceptable. Labels are essential for patient safety, and also some legal complaints is also there. Okay, so in order to ensure the patient safety, we should do labeling of the product. Okay, understand?